I'm not a big fan of memorizing. I hate memorizing, and each and every one of us memorized to be able to put those initials behind our name. But to be able to take that next step with knowing what you're doing and why you're doing it and why did I order this test is more than just memorization, it's application. When we're stressed, each and every one of you know your cortisol goes up, and cortisol blocks memory. So when I memorize and I'm in a stressful environment, I cannot recall. I don't think your patients want to see you in that environment either. So one of the things that we do, or I should say the backbone of the structure, is to take all the systems and tie them together. So if I present you a patient who has a renal problem, tell me what it's going to do to their heart. Why is their blood pressure going to change? And if their blood pressure changes, how's it going to affect flow to the brain? And what would that do to the brain? And what hormones would be released? And great, with those hormones released, what's that going to do to the lungs? How's it going to change their respiratory rate? And oh my goodness, is their liver going to kick in? Folks, these are things that you have to do in the real world of the clinical nuance, where you have to turn around and stop and go, wow, they may have come in with a renal problem, but it's actually an underlying heart problem. That's why memorization doesn't work, and that's why we don't teach memorization here. Tie the systems together. And I challenge you to find another program that does that. And there is none. I'm not competing with anybody. I'm competing with helping helping you achieve success, getting you to break those bad habits. Nobody likes change. Let's call it for what it is. But if you're constantly shown how that change helps, then you're more apt to change. That's why tutoring here at the program is just as important as sitting in lecture. Because when we're one on one with you, you will read the question. And one of the techniques we do is that you will read it out loud. I don't care if English is your first language or it's not. I don't care if you can't pronounce a Latin word. Who cares? We're not assessing your reading skills. But when you read that red vignette in front of me and you pause a few times in that vignette, I can didactically determine what your answer is going to be. I see the words you stumbled on and where you went wrong. So that when we go to correct that question, I can go back and show you the mistakes that you made. That's why tutoring is important. And we need that one on one time.